Huntington's disease, HD, is a progressive, inherited neurodegenerative disorder characterized by the gradual breakdown of nerve cells in the brain. It profoundly impacts a person's physical movements, cognitive abilities, and emotional health. This debilitating condition is named after Dr. George Huntington, who first described it in 1872. Despite being a rare disease, Huntington's has been extensively studied because of its clear genetic basis and devastating effects. Cause and genetics. Huntington's disease is caused by a genetic mutation in the HTT gene located on chromosome 4. This gene produces a protein called Huntingtin, essential for normal neural function. The mutation involves an abnormal expansion of a DNA segment known as a CAG trinucleotide repeat. Normally, this CAG segment is repeated 10 to 35 times in the gene, but in individuals with HD, it repeats 36 or more times. The larger the number of repeats, generally, the earlier the onset and more severe the disease. The disease follows an autosomal dominant inheritance pattern. This means that a person only needs to inherit one copy of the mutated gene from an affected parent to develop Huntington's. Each child of an affected parent has a 50% chance of inheriting the mutation. This inheritance pattern leads to the disease often affecting multiple family members across generations. Symptoms and clinical presentation. The symptoms of Huntington's disease typically begin between the ages of 30 and 50, though juvenile cases can occur before 20. The disease progresses slowly over 10 to 25 years. 1. Motor symptoms. One of the hallmark features of HD is uncontrolled movements called chorea. These are jerky, random, and involuntary motions affecting the face, limbs, and trunk. Initially, these movements might be subtle but gradually worsen, making daily activities difficult. As the disease progresses, rigidity and dystonia, sustained muscle contractions, can replace chorea. Impaired coordination, balance issues, and difficulty swallowing are also common. 2. Cognitive symptoms. HD severely affects cognitive functions. Early signs include difficulties with planning, organizing, and multitasking, often described as executive dysfunction. Memory impairment, slowed thinking, and decreased attention span become more pronounced as the disease progresses. Eventually, many patients develop dementia, severely affecting their ability to function independently. 3. Psychiatric symptoms. Mental health challenges are common and can precede motor symptoms by years. Depression is the most frequent psychiatric problem, often resulting from both the disease process and the emotional burden of diagnosis. Anxiety, irritability, mood swings, and apathy are also prevalent. Some patients experience obsessive-compulsive behaviors, psychosis, or mania. Pathophysiology. The mutant Huntingtin protein accumulates in neurons, especially in the basal ganglia, a brain region critical for movement control, and the cerebral cortex. This accumulation leads to neuronal dysfunction and death. The loss of neurons in these areas disrupts neural circuits responsible for motor control and cognitive processing. The exact mechanisms by which the mutant protein causes cell death are still being researched, but likely involve toxic interactions, mitochondrial dysfunction, and impaired protein clearance pathways. The progressive degeneration leads to the characteristic symptoms of the disease. Diagnosis. Diagnosing Huntington's disease relies on a combination of clinical evaluation and genetic testing. Clinical evaluation. Neurologists look for characteristic motor signs, cognitive impairment, and psychiatric symptoms. A family history of HD is a strong indicator. Genetic testing. Confirmatory diagnosis is done through a blood test that detects the number of CAG repeats in the HTT gene. Finding 36 or more repeats confirms the diagnosis. Predictive genetic testing is available for at-risk individuals who have a family history but no symptoms yet. Brain imaging such as MRI can show atrophy in the basal ganglia, supporting the diagnosis but not definitive on its own. Treatment and management. Currently, there is no cure for Huntington's disease, and treatment focuses on symptom management and supportive care to improve quality of life. Medications. Tetrabenazine and deutetrabenazine are used to reduce chorea by depleting dopamine in the brain. Antidepressants, antipsychotics, and mood stabilizers help manage psychiatric symptoms. Physical therapy and occupational therapy support motor function and daily living activities. Supportive care. Speech therapy assists with communication and swallowing difficulties. Nutritional support is essential since swallowing problems can lead to weight loss and malnutrition. Psychological counseling helps patients and families cope with the emotional toll. Experimental treatments. Ongoing research aims to develop disease-modifying therapies, including gene-silencing approaches like antisense oligonucleotides to reduce mutant Huntington protein production, and stem cell therapies. Prognosis and impact. Huntington's disease is progressive and ultimately fatal. Most patients live 15 to 25 years after symptom onset. The disease severely impairs independence, requiring full-time care in advanced stages. Because HD affects cognition, movement, and mood, it has a profound impact not only on patients but also on their families and caregivers. The hereditary nature causes significant emotional and psychological stress, as multiple generations may be affected or at risk. Research and future directions. Research into Huntington's disease has advanced significantly, particularly in genetics and molecular biology. Efforts continue to understand the exact disease mechanisms and to develop targeted therapies. Clinical trials for gene editing technologies like CRISPR and Huntington-lowering drugs offer hope for future treatments. Patient advocacy groups and research foundations play a vital role in funding research, raising awareness, and supporting affected families. Conclusion. Huntington's disease is a devastating genetic neurodegenerative disorder marked by progressive motor, cognitive, and psychiatric decline. Although no cure exists yet, advances in genetic understanding and experimental therapies offer hope. Comprehensive care focusing on symptom management and psychosocial support remains essential to improving the quality of life for patients and their families.